of everything that we work on. So we'll go into our more detailed conversation now. We have 5 topics we'd like to talk about. And the first one is, I know, an issue that's very important to you, and it's children's health. And I'm going to turn it over to Jessica to talk about that.
Hi, my name is Jessica Rebashini. I am a mom of 3 boys, and I live here in Bondurant, Iowa. So I want to talk about healthcare. It's kind of ironic that this is my question because today is the first day that I officially don't have healthcare. So it's something that I've been very, very nervous about, especially like the last 6 months. If I'm not healthy to take care of my kids, who's going to? And it includes my husband too, because my husband does not have health insurance as well. So it's kind of been a problem that we've faced. One of my children has disabilities, so he requires speech therapy, physical therapy, occupational therapy, and we didn't catch it until later on, but I started working when he was 2 weeks old because we couldn't afford to not work. So, there's a lot of I beat myself up because had I been home, had I had access to paid, leave to be home with my son, maybe I would have caught it sooner, or, early intervention is so important, and, we didn't get it until he was a little over a year old that we caught it. And I'm thankful that we caught it, and I'm thankful for the resources that I have, but there's so many moms out there who don't have the resources, and healthcare is just so important. My kids get sick, they need to see a doctor, and then I've had a lot of issues too with...
And so do you, and so does your husband.
Yes, yes, but I mean, and then another issue is that they privatized health insurance, and that has hurt us a ton because when they did that, they have, they can tell us how many physical therapy visits my son gets, and there's been times where they call to approve, and insurance just takes their time and just says, oh yeah, and they don't approve it in time, and I've gotten calls an hour before on our way saying, oh, insurance didn't approve this visit, even though nothing's changed, everything's the same, we can't approve your visit today. So my question is, as president, what actions would you take to ensure that all children have health coverage and receive health services that meet their needs?
Well, given the fact that I'm running half of my campaign on that issue, I think I am prepared to answer it. I want everybody to know what many people don't know. We are one of the few major countries on earth where somebody in your position would ask that question. Okay. I believe that healthcare is a human right, not a privilege. I believe we had better join every other major country on earth and guarantee healthcare to every man, woman, and child. I believe that it is totally insane that we are now spending twice as much per person on healthcare as do the people of any other country. Everybody hear that? Keep saying, I wonder if sometimes people hear it or not. Look, if somebody said to you, well, Jessica, I'm sorry, but we don't have a lot of money, we're not spending enough money on healthcare. Really sorry. We're spending twice as much as the people of any other country. And you got 87 million people who are uninsured or underinsured. You have 30,000 people who die each year because they don't go to a doctor when they should. You got 500,000 families who go bankrupt. So let me ask you a question. I'm happy to answer. All right, so the answer to your question is obviously I believe in healthcare as a human right. On my first week in office, we will introduce the legislation that I have written, and that is called Medicare for All. Okay? Medicare for All. And that means that over a 4-year period, every man, woman, and child in this country will have healthcare. And by the way, what we do is expand Medicare to cover dental care, not an issue, cover hearing aids, cover eyeglasses, and cover home health care as well. One of the things that I learned is we do a lot of town meetings in Iowa, just did one the other night, and we ask people, well, tell me, how much are you spending for health care right now? Okay, if you're a working class person, you got a job, maybe you got health care. I'm shocked, I really am. In this state, it is really high. I'm hearing from people who are spending $1,000, $1,500 on premiums every month, okay? And they got deductibles and they got out-of-pocket expenses. I don't know how people do it. If you're making $40,000 or $50,000 a year, how do you spend $15,000 or $20,000 a year on healthcare. That's really insane. And again, under Medicare for all, I'm not here to tell you that it is free. It's not. But you will be spending substantially less than what you're spending now. The family in the middle of the American economy will spend about $1,200, a little more than $1,200. You make $60,000 a year, you'll spend $1,200. All right, so to answer your question, we do what I think the overwhelming majority of the American people want, what is common sense, what is human decency, is we cover health care for every man, woman, and child in this country. And what that means is no matter what your income is, you go to the doctor when you need. If you end up in the hospital, God forbid, you come out without some outrageous bill. All right? That's what we do.